Okay, on a kusha on a cabo. Me family, these are the Wεll Bɔdi Bεttεh Gentri program. This na Sierra Leoneans the way don't learn boku book in medicine and thing that we go help mankind now in the black canton. Now the people we all within we don't know they get paid. We only do it because we like people them want give back to the society. Now make we do them. So there we don't know they get paid. As soon as see this now with 50th session, where will they do? We don't day now for over 2 years. Most of the material then be on YouTube. So if you go on YouTube, you type Wεll Bɔdi Bεttεh Gentri or WBBPG. You go on YouTube, you type you will see the other contents then come up, and you will be able to go through all the other sessions that we don't do before. Today, the 31st of July 2022, and as we see today, we deal with hepatitis and Dr. Senessie. I will tell you a little bit about Dr. Senessie in a bit. Okay, let's just get that bit there across. There we go. Okay. Right, and like I said, now Dr. Senessie they present to me today. Like I said before, we are a group of professionals. Then we come together for bring something back to people in Salon. This not to say Salon people no more. It is when I feature no more we or Sierra Leone no more we design them for. We design them for every Sierra Leonean anywhere in the world. Wait me ku brand camera with the gear in KRIO, not to say people are not going to understand English, but people in the world understand English. But the reason make we put them in KRIO for everybody able to understand that from we mama tongue, the language we all understand. I make we brand come in KRIO. This program not there for personalized. In order to also for you, we'll give people a personalized diagnosis. There we ask say if you sick, go see your doctor. What do they also for do? For give advice, they will able to tell you when you for go see your doctor, when you for go see seek medical help. So there, if you not feel well, go see your doctor. If you ask me a question, I will try for you generalized advice, but we'll not be able to give you personal advice because we'll not get a full understanding of all your medical history. Okay. And like they say, the content go there on YouTube and Facebook, and you can also reach me on WhatsApp. But I'll give you a little bit story about Dr. Senessie. This now we young brother, but you don't learn boku book. Dr. Senessie get MSc in dermatology. He get PhD in health science. He also don't work with a lot of international organizations. He get focus basically in PhD is in health science, focusing on international health research and education. Okay, Dr. Senessie currently is in Switzerland, whose they work for the Swiss government in regulation of clinical trials and local and internationally. I'm also Dr. Senessie a part-time lecturer. As soon as I say the man don't learn book. I don't think say me own knowledge be able explain all the things that this man don't do. But I'm sure at some point he will tell you a little bit more if I miss anything about what I say. But like I say, I'm a part-time lecturer with the University of South Wales, where he lecture dermatology at postgraduate level with the Faculty of Life Science and Education. He also now a lecturer with, for dermatology with the Department of International Medicine, College of Medicine and Allied Sciences in Salon. At one point, I know like when we say we grew up, what be the tongue? Be aspire say one day I will go to that college there. Unfortunately, the career don't take a different path. I'm also Dr. Senessie, don't work for WHO, and I'm also a founder and president of inequalities. If I get it wrong, it will correct me. Basically, now an organization, Afro-European organization, where they look at medical research for bring better life to people in way they in Africa or country then we not get the what should I say the financial muscle of the one in the West. Now also a CEO of Senessie Low Income Countries Healthcare and Consultancy Services. And this man, he don't learn he accomplishments they will take for let meet people and we they in high offices up to the president, President Obama, former president of America. So, ladies and gentlemen, I tell now on a day in the midst of somebody we know in business. Okay, so I can't hand over now to Dr. Senessie, but dear, what I say is when Dr. Senessie the presenter to now see, I don't mute everybody at the moment, but when he done, we will give people in time for ask questions. So what people can do. if you look on your phone, you go see you get this button here, these 3 dots. So when you ask question at the end, we go tell people that they ask question, where you reach that side, if you press on this side, you go see this other screen come up. And that screen that you can use for ace you up, for say, oh, you ask question, or, you know, like I say, you can use that button there, you press them, you will see this screen will come up. We come up, you can use them for chat, or you can also use them for ace you up for ask any question. Okay. However, if you not have use that, you not worry, just ace you up physically. If I see you, I will come to you. Now, me boku talk last 8 months. I hand over now to the Agbagba. Okay, Dr. Senessie, over to you, sir.
Okay. Did you get me?
Yes, I hear you, sir.
I think so you have to allow me for share my screen.
Yeah, I don't allow you.
Then what's happening now? Oh. Okay. Okay. My family, I want to thank you. Me and Dr. Charles Senessie, Associate Professor, and then I'm glad for joining hands with the team today and give a small talk about hepatitis. And then, as for me, international audience, now the first time this assures give me a talk in my own KRIO language, where a pleasure. And so the slides them they're in English. And when I can ask questions them in English or KRIO, so that at least we'll make sure that everybody participates. And that goes for my international audience. I had sent the invitation to you. You can listen in our local lingua Franca, but you can ask your questions in English, and be rest assured we'll answer them also in English. So my family, then I tell you, thank you for this talk they talk about. And the essence of the talk is for reach out the information to the lay person, so that at least we're able to understand what we will talk, especially with family in the low and middle income countries. So today the talk will be on hepatitis, and that focused on the liver. So now the liver down the road, you see this brown looking like an organ. We normally weigh about 1.5 grams, or almost 2% of the body weight in everybody. The size like a football, not that to shilling ball or that big football the way that they use at the international match there. And this organ, they perform a lot of important functions then, as we'll be able to highlight very soon. The liver gets several functions. If we start, go right in the clockwise direction, they take part in the fat synthesis to produce fats and cholesterol, especially. And they take care of the sugar production, the glucose, which is why when the liver get issued, we get problem with the diabetes, etc. And once in a while, we take in some bad poison them and toxins them, whether we self-aware or not aware of them. So the liver get the work for broke down their toxins there, so at least they become harmful and therefore eliminates them as well. And it also produces what we call bile, where they take part in the metabolism of fats, as we say, you know. And they take part in what we call amino acid synthesis. This is a big word. They will not know this for worry. I just want to set the stage no more, you know. And certain hormones and enzymes there, with some of the enzymes there, we also need them for breakdown. There's some medication that they take. And then we also help for the absorb certain vitamins that we will take in. It's vitamins that we need so that we will get enough well body we go able to support what we do in everyday life. And then, so what's in a hepatitis? Hepatitis from the Greek word hepa for liver, it means inflammation of the liver. Big word, you know. And hepatitis always are the result of damage to the liver cells. And what did they cause this damage to the liver cells? Plenty. It could be from accident where you bruise your liver, somebody hits you, you get accidents in road traffic, etc. If you get medication, the doctor they prescribe, or where you say they go buy in a pharmacy, or you the pepper doctor yourself, which is why you're not fine for the pepper doctor yourself. Always go to the correct medical person. Or it could be also due to drugs the way you take. For instance, it could be alcohol and any other drugs the way substances of abuse. It can be from things that way they inside your body for breakdown, things that way you don't eat. Or it can be something where they can inside the wall with what they call autoimmune diseases, where in your body they produce that thing where they use for fat disease, and they fail for recognizing that you don't cell that they damage. It can be secondary to things that like virus, it can be like bacteria, it can be like parasites. We'll talk about that more. But again, most of the common causes of hepatitis, not to just them viruses, bacteria, parasites together, but rather now we don't think the way they do, we own way of life, alcohol misuse, some disturbances there in the fast system for breaking down, and the side effects of medication, including even them herbal medication, the way they take. Anything way you take, way they go inside the body, most they can be metabolized or break down by the liver. So generally speaking, when the causes of hepatitis, going again in the clockwise direction with alcohol, most of it can take with 2-3 bottle or 2-3 where they call for bend elbow, but each of the alcohol they take, it get for go the liver for leg will break and down. So excessive use of farm, it make the liver to overwork and it get for get problem with them. If you work too much, excessive workload, when you work, you don't under a lot of stress, as we say, the body they try for produce some certain chemical that will be able to dampen the stress. And some of the chemical they also they cause problem to the body. Also for the one the way they smoke, where they champ tobacco as well. The chemical they could the inside this tobacco, it cause a lot of problem, where at least it damage the liver as well. And also when you go to doctor, there's a medication, the doctor not get no other choice but for prescriber for you. They say they be metabolized by the liver, the one the way that is substrate for the liver, and they say they cause problem. And also the OTC, the over-the-counter medication, the way you go buy Panadol, you go buy other alpha medication without doctor prescription. Excessive use of farm can also affect the liver. And it also happens you get some infection, the viruses that we'll talk about, or some illnesses them for inside the COVID, which can also affects the liver one way or the other. Then, if you get stressed, especially most of you say, the current world now, we get a lot of stress. Stress that leads to production of certain chemical them, they sort of reduce the immune level of the body and also be metabolized through the liver. So that will cause problem there. Some food they would eat sugar and their flour products them, it can also affect the liver. And then we get something that within the environment, we like some what we call heavy metals and some of the shell talks and some of the other things where they treat bed nets. Unfortunately, they stop the malaria, but they also if you ingest them, they cause a liver problem of the enter the soil that they cause liver problem. And then some soils they deficient in certain chemical that we're supposed for inactivate some bad mineral them. This is like in New Zealand, where if the soil deficient in this work they're taking this chemical and they deliver also they under extra burden for getting rid of the toxins they have. Some food allergies them, something they don't be able to tolerate at all. Some people don't able to tolerate milk. So certain type of milk or so. All the things that we take them in, therefore, give extra work to the liver for actually put them under control. And then poor nutrition. Some of them they eat well, we're too busy for it. They eat well, the money, we didn't work in place, they will eat, just go take some junk food them. All the one they do get for metabolized through the liver, and it causes a lot of problem. And again, people all like for drinking coffee with the caffeine and the energy again there. Coffee also, it's controversial, but it's really the effect on the liver as well. And the energy again, then they will take Red Bull, some of them, they will not even know the constituents. So these are some of the main causes of hepatitis what I don't highlight so now. And then, but very importantly also, the one that due to the viruses. And then for many years, this graph here from the WHO, where they lend me some of the slides of Olago presenter today. I thank them very much. And then for many years, we focus on HIV, malaria, and tuberculosis. Forget said hepatitis, especially the viral hepatitis, they dance now with backyard. So if you see this graph here, you notice the death rates from tuberculosis, from HIV, tuberculosis, and malaria, it really they go down over the many years since 2000 and 2015. However, the death rates go like what we call exponential rise. It continues for the rise, which means we do a lot also for target this issue of viral hepatitis, so that at least we will bring the curve down. And the good news is that the hepatitis, especially the B and C, what we'll talk about, the way that they transmit and the way that they infect people then are similar to the HIV, where we don't put a bit under control so well, which means the gains that we use from HIV, it's possible for us to also flip over to hepatitis so that at least we will put everything down nicely for everyone. So this line from the WHO, this past week on the 28th of July, at the World Hepatitis Day, and I joined WHO in a webinar where we all join hands together to see how best we will bring that COVID down again in viral hepatitis. Because according to the WHO, 90% of people that they live with viral hepatitis, they don't even know, they don't get no idea, so they get them. You know, and then so we need to bring this hepatitis services closer to the communities so that people can really access them. Like waiting in medical and research networking, they do also, they take mobile clinics, go to the villages, you know, so we will work in the peripheral, in the primary healthcare, we can integrate some of these services into our daily activities then, so that at least we'll be able to bring that COVID down. And it alarming that almost 3,000 people, they die from hepatitis B and C every day. I will tell you the route of transmission very soon. And so resources for the hepatitis treatment services, we need to bring her closer to the communities. Resources can mean funding, can mean material, can mean human resources. Like we know they watch this program now, nobody is small to make a change. So you always get a role for play for help bring this hepatitis pandemic down and let we give the future leaders of tomorrow a better chance. And it is a fact, say every 30 seconds, one of our young brother and sister and somebody close to we, they're losing life to hepatitis B or C. And we can't get, we know for wait for get tested. Go to the nearest health facility or healthcare worker, let a lead you there, let get tested. So at least we're able to bring that down. 30 seconds for somebody die from hepatitis, that used to be malaria many years back. But now we don't bring down the back on cause. We can do it also for hepatitis. Now, waiting at this hepatitis, the viral hepatitis where they talk about, we get 5 distinct diseases caused by the viral hepatitis. They are different ones. They will call it A, B, C, D, and E by the letters there. Now, hepatitis A, it just accounts for 20%, 20-25% of hepatitis in a developed country like Switzerland, where are they? But the percentage is more in developing countries like Salone or other low and middle income countries. The transmission now through the mouth and the excreta pool don't go ahead, you know. So therefore, if we learn for wash we handle well, you know, we not contaminate yourself with that excreta there. Other word they do they call up a KRIO, but I will spare myself that one day. Contaminated water or seafood, because when they water, we can able to get hepatitis A. Normally, the period from which we will get until we get disease is about 2 to 6 weeks. And the patient is really able to pass this disease to other people that during this period call it infectious, you know. But the good news here is that the disease, with or without treatment, it can go away with rest and good nutrition. And the recovery now almost like 85% of cases within 3 to 6 months, which is fine. And so good hygiene could actually for stop hepatitis A. You know, they become chronic and then you know get long-term complications like your other colleagues, the company we can talk about very soon. And the population will get vaccine for hepatitis A, which is fine. Hepatitis E also now another one way like hepatitis A is they go through the mouth and poor hygiene. You know, a more prevalent in Asia and Africa, where you know most of Asian and Africa countries, they are classed as low income. We all share the same entity of lack of healthcare, lack of amenities, and lack of the necessities of life. And then the hepatitis E is transmitted through the fecal-oral route, where I don't talk to see infected poo, we come out. And in most cases, they know that they kill for sale. But it can be more serious in women that do pregnancy, because pregnancy, you know, they challenge the immune system of the woman there. And there's also leads to complication of the pikin when they're born. But here again, the good news is that the patient with hepatitis E, they recover completely. But the bad news is no vaccine for hepatitis E. So you just go for make sure so you prevent yourself, and when you get yourself infected, you well, if there's a chance again, you get yourself infected. So therefore, prevention is here really better than cure. The hepatitis A and E symptoms, as I say, they get 3 phases. They can get no symptoms, they can get non-specific one. We get the early phase, we get fever, joint pain, and then some rash them, I would say, but they rash them more, or some swelling of the foot them. Then we get the other one where before the jaundice setting, we call it the pre-ecteric phase. You get the tiredness, the muscle, they hurt you, they feel for eat, the vomit, or the feel for vomit. You can get cough, belly pain, and then you urine, and then it can dark, and the stool can light. I will tell you more about that why. And then the last phase, that is jaundice phase, where you go see, say, you either all yala, we call it jaundice malaria, and then you so the symptom can worse again, you get more, feel for eat, you feel for vomit, and they vomit as well. And then your skin that also can develop lesion them, some crashing at the skin them. I will tell you more, but it be secondary to the virus itself. It is secondary to something where we call bilirubin, where there is a problem for like get rid of from the body. So the diagnosis is really history and physical. You get for the doctor or the healthcare person, you get for really go through your history and try to see whether you get contact with anybody who get the hepatitis. You don't go to an area where the endemic area where you get high level of this hepatitis. So the thorough history examination is very important. They will do a blood test for you. You don't need to worry about most the doctor. They will able to interpret this blood test, tell you so you get something we call anti-hepatitis A. The antibodies, them, no worry, that big word, but for the other doctors, they no more. It indicates whether you infect hepatitis A. And it can persist for only about 4 to 6 months, But your doctor be able to diagnose hepatitis E, test your blood or stool for certain antibodies, them or enzyme them. But that did not for just tell you, see, as you lay post, you say there are possibilities for adequately diagnose and take care of hepatitis A and E. Now we come to the big one now, the hepatitis B. Hepatitis B, inflammation of the liver due to the B hepatitis virus, And here the transmission is through blood and secretion where they come inside different parts of the body, especially the mommy and daddy parts, And also if you share infected instrument, we will like for would tattoo them. If the instrument is not sterile or in a barbing shop, or then nail clipper the would they use, somebody don't clip a nail, a mistake cut insect. Or shaving sticks them. And also, some of the other topical issues like the female circumcision or the female genital mutilation, if they don't use sterile material, they use the same one for do the procedure for everybody else. They will infect lots of people. Or even toothbrush they use, In effect, what they say is that anywhere where there is a break in the continuity of the skin means you can that way then the body and also inside the muscle go down to the other exit, all are part of the skin. So therefore, if somebody really get a break in the continuity of this candle or the skin, it will cause problem there. And even if you get wound where it ooze blood or they ooze some chemical them, we infected with the hepatitis B virus, including also infected menstrual blood. This I get them from New Zealand also. It's also all part of ways of transmitting hepatitis B. So not for sure also. Some who get the habit for cham food, we give them baby then if you get a cut in your mouth, you infect hepatitis B, you get into that picky way accidentally say get cut in your mouth, that is where you transmit them. And picking them, and some of who they go up, they get a habit for shape chewing gum, share them, or the chamas will give the other person. They are the one that they on a way, a sort of way, but they are evidence-based way that they transmit hepatitis. And then if you get unsafe injections, then especially where some parts of the world, it's still our community, then our villages, and some clinics there, they don't get enough injection needles then, for go round. So they know they sterilize them. It's actually they're not supposed to sterilize some of them. So if one person is infected, they can pass on to the other two. Some of the acupuncture thing, the Chinese that they do, then needle they put on the body. If they're not properly sterilized or they not use new one, them it will be a problem. Dental procedures, I get a story where somebody going to a hospital, one person they use the same needle for inject the local anesthetic in the mouth. Then needle they will not say they're small, they act forget, but at least let us sterilize that, or best case now we'll get a new one for every patient. If we involve in mommy and daddy business, unprotected, so either through the mouth or through the other parts of the body, or so that one itself again. For no sooner a way hepatitis will be transmitted, so therefore use protection like a condom or avoid it at all. I mean the unsafe one. And also very important, also the mama to pikin transmission, where the pikin the can at the wall. At that moment they do the blood from the mama and the blood from the pikin they can mix. So therefore, if the mama is infected, it will likely infect the pikin itself during the labor. Now, if somebody infected with hepatitis, we get the acute one where, some days the positive 30%, you not get no symptoms at all, or it can go to liver failure. But they can normally require for this, and then they have no further problem except they go infect themselves again if they're not vaccinated. But the chronic hepatitis means the virus is then at the blood for more than 6 months. And this one, it can because it can progress to where the liver they go, but could scar them, and then it can lead to liver failure. It can lead to what you call the fibrosis, and then the cirrhosis, and big time, but also the liver, they become not normal again. They get what scars them. And that will lead to that jaundice with the yala and other complications there. Then the spleen will be, you get water at the belly. I will tell you more about this water at the belly. Your food all go swell because the belly is big, the vein, the able to gain back again, the blood will come up. And then they can, where the liver don't finally go bad, and then they're able to get rid of the bad chemical and now. So the patient and now the chemical that they enter the brain, now the patient can become confused. And then when the liver enter into what you call the cancer phase, now you think it really go bad. Really, Now, but this is life on hepatitis B. What's in the hepatitis B? How big a problem at the whole world? This now since 2019, just but it then published in 2021. This data by the WHO, courtesy of the WHO. We see, say, for hepatitis B, the African region we get about 82 million. And then, globally, there are about 296 million cases of hepatitis B. But Africa get 82 million, and then the Western Pacific, they top the list, 115 million. And then we get the Europe or other one. But despite with 82 million, for Africa, we really pass most of the other one, them also like Western Pacific, we're not for rest. See, we'll not get better because the next slide shows it. We picking the one of the future leaders of tomorrow. And for a global number of cases of 6 million or 6.4 million, 4.3 million are from Africa, where that's worrying, which means we really get to do a little bit more for prevent this thing happening in Peking, because they could develop the chronic hepatitis, and then it will lose a lot of future leaders there. If we see that cover show earlier on how the hepatitis, they dance now with backyard. We need to do something at this point in time, at this defining moment. So we all get a role for play for bringing this curve down and say we're future leaders of tomorrow. What are the symptoms of acute hepatitis? As I say, acute hepatitis is less than 6 months. But again, you get the phases and what we don't describe with the fever, the rash, the foot swelling, and then also the inability to feel for eat. If you get fever, cough, your belly hurt you, you get dark urine, and then you go now to the jaundice phase where you get yellowing of the skin and the white of the eye and ball. They also become yellow because of the accumulation of what you call bilirubin, where there is an imbalance between the production of the bilirubin and for excreta, when the liver also to do that. So if we get problem before you get to the liver, inside the liver or after the liver, you get this issue of yellowness of the eye. But that the doctor of the will explain more in detail with the clinic. And then the chronic hepatitis B, now I will show you the curve just now. So they cannot get problem at all because the liver is such a generous organ, and we don't damage so much percentage of it before it begin growing. But if the hepatitis B, it get chronic, you go to cirrhosis with them, but scars them, and liver failure is setting, then you will get what you call that jaundice, what they call jaundice malaria, because the eye, the yellow at the beginning of the tongue. Unfortunately, we black man, the skin will not be able to see easily because of the color, but the eye now you see all the yellowness of it because of the bilirubin, when a chemical where they produce by the liver also. And then there is an imbalance between the production and the excretion, which means the liver is so damaged that enable get rid of the bilirubin, so they accumulate and affects a lot of other issues there. The spleen can be big because of one of the other organs there. Then you get also fluid at the belly. The belly they swell, because of the big wall that we get what we call the peritoneum inside and outside covering inside the belly. When are the fluid they go together, because one of the veins the way they supply the liver, they get swollen called the portal hypertension. Or they drain the liver. So then you get also swelling of the feet, especially the legs and feet. But all this thing why they explain, so when you begin to see, then I foresee your doctor as early as possible, or better still, get tested and see follow-up. You can go to call that confusional state where the brain not able to detoxify this thing there again. So you get also called encephalopathy, which means they able to get rid of the toxins that they can be confused, they can get lots of other issues. In the next picture, I will show you a picture just now. Then it can finally progress to liver cancer, where it's really bad. And the cirrhosis also can be compensated, where in the liver, still get the ability for work. It can be decompensated, where also almost they fail now in the liver, and that are a very end stage, not nice. So the two compensated one, the way on the left-hand side, we get something that we can happen where the doctor will explain you go see some yellowness around the eyelid, locus and talisman. We get the parotid gland will enlarge. You get something that we call spider neighbor. When like small blood vessels, they know more they form around the abdomen or the upper chest, where they radiate or the hand, they go in different directions. Them. This is thing that we can see also in other areas like pregnancy, but in liver failure, you can see most of them. The body go big, like especially for man, the spleen, and all the other thing that always they see now the pictures that can happen. You know, the general you get jaundice, you hear all the common that you hate, you get loss of hair. Then when it really don't bad, it decompensates, where the liver don't no longer get the ability for it to work again. You get the neurological complication, they keep them drowsy, if you go unconscious. You know, you can get a sweet smell where they come on the patients in mouth, we call fetal hepaticus, you know, and then, but this all the doctor will explain. And for just no say, ways where you get liver disease, you get some other thing there, consult your doctor, as my colleagues say, we're not there for 100% diagnosis, that for just to raise awareness of the hepatitis. And the diagnosis, normally, they can do tests and at the laboratory, we have good laboratory, especially in salon as well. We have good laboratory that they can ultrasound and other radiological investigations then. And then if they're not too sure, they can take a pinch the liver small and pull some part of the liver, and like the second will explain you, they examine them and see which they go on there. Now, these are some of the serological markers where you don't need to worry about the slide and for the other colleagues, that, or in case you go do liver function test, you pick the results, you see some of that in there, you can go back on this slide and try for see what it means. Before ever you talk to the doctor, or if the doctor explains you, you go say, Dr. Senessie explained this to me. Let me come back and explain what is hepatitis B, the surface antigen, and the others. And now I will show you the graph just now. Now, in the case of acute hepatitis, you know, you get a surface antigen where it can remain positive only until six months after exposure, 24 weeks. If you go beyond 24 weeks, which is 6 months, then definitely now we are talking about chronic hepatitis. But you don't need to worry. This is for just show you, say, in the case of chronic hepatitis, the surface antigen remain positive for a long time to come. The others that can play, also the anti-hepatitis B, I may call antibody, can remain positive for a long time. But you don't need to worry. This is not for just the doctor, for interpreting results. And the treatment of hepatitis, the good news is that the acute one, it could get away without any issue. But then the chronic one will require medication. The way, again, the doctor will be able to prescribe the medication, but maybe you will need to take medication for the rest of your life, you know, for keep the virus under control, you know, reduce the risk of the disease, and also reduce the infection of other people then, you know, and always get for use protected sex, you know. And then the treatment of hepatitis, we get drugs that are available where they now, you know, the antiviral medications, them, and then the other interferon. The worst case scenario, if actually nothing we're able to do, they can able to do liver transplant for you with people in the way they able to do them. And I'm sure Shalom will get here soon. Now the hepatitis C, the hepatitis B and C, as I say, now you transmit it through blood and body secretion when there is something cut your skin or something cut inside your mouth or any start along the skin inside the body. You know, you can get that from blood transfusion, which would be a big problem in various parts of the world, especially before 1992, where the screening was not so optimal. Lots of people became infected, and then the injected drug users, them where we get in other parts of the world, slowly they go back now with low and middle income countries where they use needle them for inject themselves with them medications, them, and then with the drugs, them where they don't get enough needle, they share the needle, and that's bad. And then on steroid needles and the other bloodletting instrument, anything they cut, you know, you tattoo, you ear piercing, and then you razor blade, etc. And then mother to child transmission. The prevalence of hepatitis C globally is 1%. And in Switzerland, we are only 0.5%. And we still try to get a correct seroprevalence of a lot of the other countries, there, including Myoma Salon, where they say it's about 8%. Well, we therefore do a national seroprevalence, which is, well, I think almost in preparation now to be done. And as I say, the hepatitis C can develop without sign or any symptom in 75% of cases, especially like in Switzerland or around the globe. Or if present, it can be non-specific and short-lived. Also, you can get skin, so the way they affect the skin rash. This skin rash, they can be secondary either to the virus itself, we get deposited on the skin, or to certain chemical them. We are not going to bother with but no certain chemical that the mixed globulins also they can be deposited in different parts of this of the organ, or it can be secondary to the bile salts. Now, the prevalence of hepatitis C infection by the WHO. This is data from the WHO. Globally, we got about 57 million. In Africa, we get 9 million. But despite that, we still for actively push for make sure at least, we prevent ourselves with vaccinate, etc. Prevent ourselves. Because no vaccine for hepatitis C. And then safer injection is very, very important as well. For demand safer injections in health facilities, therefore, see the needle for make sure it's well sterilized if it's possible. And the healthcare workers, please, for really make sure we use sterile needle, the way they do procedure. At the patient and not get way for proven, left with conscience, but we can do that really by just going the extra mile. And then these are the hepatitis B infections from sterile needles, up to so millions or thousands have been done because of poor sterile needles. The management hepatitis C, normally accidentally you can able to diagnose and maybe for routine blood work or abnormal liver enzymes, which we call the alanines, transaminase, or so, and on the others there. Or the test that because of the risk factors and because they're exposed to needles or they're not sure it was sterilized, or maybe they get history of blood transfusion, where they may be sure so they screen the blood for some other thing. And then initially, would they be classified hepatitis by the unique genetic makeup called a genotype? You don't need to worry about that. Now 6 of different genotypes. But the good news is that they don't put all of this now into one, so that at least we get some combination medication they do with the target all these different subtypes of hepatitis C. And 95% of patients then they can able actually overcome the hepatitis C and be cured from the drugs. But again, your change in lifestyle, they begin plenty, all go well if you get hepatitis and alcohol and not go together because it causes more damage. But also if you're obese, if you overweight or you're obese, then you get to be watch out for the hepatitis. And therefore prevent the blood transfusions, at least the blood should be screened properly, no sharing on needles, and safe sex practice, please. And then this is not the hepatitis C markers. You don't need to worry about this for only the doctors there or the one within a lab. But the good news is that you get markers that will show, you test for hepatitis C infection, you got another marker there with the second one, we will show, with the differentiate between active and you don't get infection, you don't mend yourself, or the medication don't mend yourself. You can use that for monitoring the treatment outcome and also how effective or this treatment or efficacious or the treatment they don't give. These are the interpretation of the result. Don't worry about this slide, as I say, for you, the patients, with the doctor there and the lab man there and the master service people then, the KRIO actually interpret, you see whether you never get infected, you get recent infection, or you don't go chronic, or you don't previously infect, but you don't resolve now because of treatment or natural selection. These are some of the markers there. You don't need to worry about this slide because of time. And hepatitis B, we're now in the last one now. And a new one where they discovered 1977, sorry, but the good news is that hepatitis D in need for attaching self to hepatitis B for able for multiply and infect other of the cell of the liver. It's self-limiting. It can lead to end-stage liver disease with all the other complications there. It's more common in adults than in picking them. And it's more common among people who inject themselves with drugs and other parts of the world what they call the Mediterranean. You can diagnose them from blood, and the manager is mainly supportive. It may progress to liver transplantation and the liver failure also. There's no vaccine for hepatitis D. But of course, because it is attached near hepatitis B, so therefore, if we vaccinate against hepatitis B, it will prevent the multiplication of hepatitis D because you need hepatitis B to multiply. So, all the way to the talk, we therefore think of the one the way this message is meant for, again, the one that in the hard to reach community, like what to do to mobile clinics, the healthcare workers, the patient them. So always get for talks with messages to be targeted for reach the people there with the hard to reach. So I include this slide for learning and also they think about them and now make with this program in KRIO. So now let's talk about we don't get the hepatitis, you get the cirrhosis and then what can lead to liver cancer. The statistics show say the incidence of that scarring of the liver range for 8 to 20% if they're not treated chronic hepatitis B. And among the ones that with the cirrhosis also, the risk of that decompensation where I've not shown as say really liver unable to do anything again, it will really go bad, it's about 20%. And the risk of the cancer in patients with cirrhosis of the liver, this is from publications for the one the way one that access on this publication. The risk of cancer in patients with cirrhosis is about 2 to 5%, but this risk can be higher if you get some of the other factors below. Cirrhosis, if your age, the more advanced the age of the chronic hepatitis, the damage to the liver, the older the age group. If you're a man, if you're I'm African of origin, African Americans or so, and then of course if you take too much of alcohol, especially the hard liquors and the other ones now, it really progresses faster. If you get co-infection with other hepatitis virus or HIV, that also, because they dampen the immune system and accelerate you faster. If you get other diseases, the way they reduce your immune system, for instance, diabetes mellitus, or other thing the way they affect your body ability for the thing the way the liver they get. If you also smoke, nicotine is also something very bad. It activates the hormones, them, it causes a lot of damage to the liver. If you get a positive family history, a genetic history of hepatitis or to the virus, or higher hepatitis, the surface antigen levels, you also get a risk for go down faster, So now we don't talk at the local level, the clinical level, the hospital setting. Now we go a bit look at the bigger picture now. This is a slide from the WHO, where they say we don't look that graph from that 2000 to 2015. They say, no, we all get for sit together for see how we will bring this hepatitis, viral hepatitis under control. And so they develop a strategy where they don't update now. We all they try to say by the year 2030, at least more than 90% of these cases, they are not going to occur again. And under 65% of mortality will be reduced, secondary to hepatitis, viral hepatitis. So this inside this book will show all this graph and waiting at the indicators the way they try for achieve by 2030. So we all can able to access them and read them and see yes, whatever we do in that little homes, in little clinics, in little campaign, we all they add to the global picture for end hepatitis by 2030. When are the cutoff point for achievement of universal health coverage, one of the sustainable development goals there. And then the service engagement is also described inside this book, sorry, for changing to English, for the prevention, the diagnosis, the treatment, and the chronic care. And the prevention also is very crucial, in terms of the primary prevention, that contact between the virus and human being, and the secondary prevention wherein the person don't already get the hepatitis B, you prevent the progression to that cirrhosis or end-stage disease, or you don't get cirrhosis, you don't get in that tertiary prevention now, the preventer for letting not die, you prolong a quality of life. It's all possible. It's all been described. So we get a role for play. We have the tools there we will use. And we can use a lot of private partnership like we give all hepatitis, and all other organizations, all other NGOs or civil society, that way they complement the efforts of government, they complement the efforts of the international community, including the United Nations, of which I'm part, and the sub-agencies like the WHO. So we all get a role for play. And we can end hepatitis with a united effort. Everybody gets a role for play, no matter, nobody is too small to effect a change. You prevent it in small Pekinia by vaccinating the Pekinia. Now, the WHO, if in the last week webinar, Pekinia forget the vaccination, immediately they are born at 0, and then they can able to get it at 1 month and then at 6 months. You need about 3 doses in Pekinia, and also even in adults, you need those 3 doses, then at least for be effectively vaccinated, and so that you develop immunity against the disease. All pregnant women for hepatitis should be tested, and then treat hepatitis B with the antiviral medication that we've also about. Expand hepatitis prevention testing and treatment services to ensure that we get access to all of this one. Let's use any other means we able to do for achieve this aim here, and maintain essential health services even during the COVID. Now be a challenge, but most of we actually say COVID not able rule with life. If you go to one mobile clinic in the middle of COVID, and there are lots of other things that we occur with COVID, like self-testing, etc. And with COVID also, and hepatitis, it for the worsen the immune system and progression of disease faster. So we therefore maintain the essential services in hepatitis. So therefore, in conclusion, hepatitis-free world is achievable, but together we can make it happen. Together we therefore come together on all countries and join the WHO and the other UN agencies there for end viral hepatitis by 2030. I thank you for your attention, and then that now we end your office. You're always welcome, Ben. I'm open for questions. Thank you.
Thank you very, very much, Prof. Senessie. Thank you very much, sir. Let me fumble them. Hey, Zainab in group, they clap. Wow, okay. Bear with me 1 minute, please, where I get this thing sorted out. Okay. Yeah, I get Dr. Daniel K. We will ask question. I'll give you timely answer. Dr. Senessie, thank you very, very much. Now the floor is open for questions. So if you're able, use the tool for raise your hand. Use the tool. If you're not savvy, use the tool for raise your hand. Just raise your hand physically. When I see you, I'll count to you. Please, dear. If I not count to you quick, you know, miss I ignore. If just miss it, maybe I not notice you quick, please. Okay. Okay. Dr. Daniel.
Yeah, greetings to the house.
How are you, sir?
Are you getting me? No,
Yeah,
fine, sir. Fine, sir. Yes, the lecture is very interesting. I personally have been going through a lot of challenges with respect to this hepatitis, especially hepatitis B. So I have some clients that I've been following up for a while now. They have all been tested for hepatitis B surface antigen positive for the past 2 years. So they have been having recorded symptoms of fever, fatigue, and anorexia. So I don't know what actually can we do at this level to make sure that one, we treat them in a way that the surface antigen should be negative, and two, we manage the symptoms that they are having. So what can we do to make sure they have a negative test and also to take care of the symptoms? Because that is a major challenge I've been facing all this while. Thank you.
Thank you, sir. Dr. Senessie?
Yeah, thank you very much for the question. And if you go back to my slide, where I show you, when was the hepatitis B surface antigen positive? The only way where it could be negative is if it's an acute infection, but when it's become chronic, it becomes positive. That's one. So you therefore just give the symptoms them as they come and prevent progression to the chronic to the end stage liver failure. But I don't think for chronic hepatitis you can get the surface antigen negative.
Does that answer your question, sir?
Thank you so much.
Okay, thank you very much. Okay. To the other doctors on the panel, if you think there's there's some way somehow that you can add benefits, let me know. If you can add value to any answers that Prof. Senessie has given, please let me know. Yeah. For the underway, sorry, I'll go English. The doctors they were in the panel. If you want to add any statement to it in Dr. Senessie don't see already, feel free for add. Okay. Yeah, Anne.
Oh, can you hear?
Yeah.
Well, thank you so much for a very interesting and informative presentation. In the early 90s, I was working as a mechanic for a Northwest Ambulance Service, and I was maintaining a vehicle inside when I cut myself. Within a week, I had become jaundiced and extremely fatigued. For 6 months after that, I couldn't work due to the fatigue and the jaundice. However, they stated that it was hepatitis non-A, non-B, and never gave me a distinctive designation of what I had suffered. Since then, I've been suffering from fatigue all the time and constantly fighting it. But I'm just wondering if the professor could enlighten me in any further due to the advancements of technology since then.
Dr. Senessie?
I did not get a question. You had fatigue and you are diagnosed non-A, non-B. Have you done a recent test again since that connotation has changed to see what exactly you have?
No, they never told me anything. They just said that I'd have to live with the fatigue, and there was nothing that could be done. But they said it was hepatitis non-A, non-B.
Yeah, that's the whole connotation. If I were in your position, I would do another retest again.
Okay.
Now that we have latest technologies and see what exactly you have. Because if the early 90s or so, technologies have changed, the sensitivity and specificity, which means simply means the ability for test you has really greatly increased. You know, at least when the sensitivity will tell you that so percentage you are negative or you are positive with the sensitivity. So I will really recommend that to have a retest and then see where you stand now.
Okay, thank you so much for your time, and thank you for a very interesting presentation.
Thank you very much, Anne. Yeah, I see Zainab, I see say when I want to ask question, I'll count on a bit. Usman, we don't ACR, so I'll count on a bit. So give me 1 minute, please. Yeah. Usman Edward. Usman Edward, you want to unmute yourself? Hello? Yeah, how are you? Yeah, what's your question, sir?
Yes, sir.
It's very faint. Can you speak loud?
I want to appreciate the doctor for this powerful education. Never mind, I can't leave, but I just 1 or 2 questions to ask. Sierra Leone, I've been just a colleague to the work now at the core hospital. So you tell me about the rampant
Mr. Moderator, are you getting the question? Sorry, you get the question.
I try for listen to him. Get a chance later. If I will get him, I will repeat it to you. Yeah, go ahead, Usman.
Tell me about the appearance of an individual. So in somebody will get sometimes you know to die and body to bomb, body to final one, but most of them get that. So doctor, I don't know what I advise for the from somebody who is just let's you don't mention so many different things, but if the appearance of the body, sometimes it's possible to get body to put together diseases. And one, I want to know the statistics for hepatitis for Africa, more especially Sierra Leone, as you mentioned earlier. Then again, for pregnant women, then, where she just born, maybe the woman now infected infection, at the end of the day, it can't born. Really, I want to know the treatment for that, for the young baby.
Okay.
I'm a question.
The problem is most of what you say are not able to I understand almost if you talk about something about you get friend with 34 and then get some issues and they will play with hepatitis when the number be the rise. But the last question, I get that question, they will ask about Bella woman. If we did for men hepatitis in Bella woman. But the first 2 questions that we asked are not quite clear. So I don't know if like audio. So what I would say is if you're able to type them on the chat, I'll be able to ask them for you, please. So Dr. Senessie, they get any cure for Bella woman then we get hepatitis?
Well, first of all, with the Triforce, according to the WHO, all Bella women therefore be tested for hepatitis. If they are positive, they could be treated. But then for the unborn child, you know, the idea is if the child is born negative, immediately after birth, therefore given the 0 months of the vaccine. At the 0, you know, 1 month and 6 months. So at least for maximally protecting. But effectively, all pregnant women there therefore be tested for hepatitis C and then waiting for them. Okay.
So now hepatitis C number then go test them for. What about the
other hepatitis B? Hepatitis B. Yeah.
Or what about why not that no more? Why don't they test them for the other one then?
Well, you can also test them for hepatitis because there's a vaccine for hepatitis B. You know, yeah. So without a test time, you can vaccinate them, but not for C.
Okay. Why do we talk about Belloma? Dear Zainab, I can't in a bit. Why do we talk about Belloma? Question what they want to ask. So what about person we get them, like Belloma, well, Kumbra we get them. It get, you know, it can allow for breastfeed?
Well, like HIV, normally breastfeeding is discouraged, you know, but that's a very controversial issue then, you know, because the virus can be transmitted through breast milk, you know. So even with taking the case of HIV, it was like there was a time when they could say they can allow them for breastfeed. But then, of course, you don't go beyond stage that if you be positive, they can be pasteurize the milk, they can be treat the breast milk, so that at least it is negative, they're going to give to the Peking. But initially, like in the case of HIV, we had experienced for 25 years, the idea was that you allow the mama for breastfeed the Peking. But then 25% of cases, that Peking will get the HIV. Then it becomes a social problem for the family. I mean, it's quite modern. It was hotly discussed in lots of, I mean, those of us who have been HIV/AIDS can come to also for add. But then later on, in the Kenyans, there are lots of research which shows that you actually treat the breast milk, you can cook them or boil out to some level where you inactivate the virus, they can even get the Peking. So that was like also maybe you could do the same thing for hepatitis also.
Because I will ask question concerning that side about the longevity, you know, the lifespan of the virus where it is outside the body. I will count a question on that in a bit, but that allows Zainab.
Yeah, it will take about 7 days outside the body, just for yeah.
Well, that's I'll count that in a bit. Yes, okay. Zainab, I see in our group, we are very excited.
Yes, we are.
Thank you very much for attending. Thank you.
And the whole team.
Yeah, I can see.
Thank you. Hepatitis is everyone's business. So the whole group is here representing and supporting the work that you do. Well done.
Thank you very much. Thank you very much. You're welcome. Yeah. So when I get any question, want to ask directly?
Anyone has any question? We've just had a very successful event as well on hepatitis awareness. So I doubt if they have any questions because we're well educated and Charles was there. Dr. Dioku was there and they presented.
Okay.
Yes.
Yeah, so okay. Thank you very much. Thank you guys very much for attending.
Thank you.
Dr. Senessie, as I said before, how long this thing go stay, go there alive, outside the body?
According to research, it can stay as long as 7 days outside the body. But of course, it depends on the conditions, but that's what B and C, that's what they said, the book says, can say about 7 days outside the body. So therefore, which is why accidental spilling of blood, accidental spillage of blood, you really get for make sure so you wipe them and disinfect the whole area. If you get, because if there's spillage of blood and there's a discontinuity in the skin without effectively disinfect that area there, somebody mistakenly contaminating self, it could be get infected.
You see, the reason I ask this as well is for people in back home. We all don't go through that way. They made bad way. They can't conduct you and bad me something day. And when they keep babies on telling they chop the skin. Now, sometimes they then blade and they can use. They're not to one person more than can use and pass. We all know. So man go to the blade, but some man they know it to the blade. But also even when it to the blade, the comb way be they use. See now that comb and blade now they use it to the shibang. To the normal clipper where they can use now. Now, when they use that, even the clippers, if they use, if they cut somebody, what you go advise with people that we local barbers them, for example, or maybe a dresser or whatever like that, what you go advise them for do after they don't cut somebody here for them go to the next person, because obviously they don't go get rid of that clipper, they just because they don't wound somebody. But with the measures where they go take for prevent, for let people not begin the pass here from one person to another?
Yeah, I mean, they can sterilize the clippers them, and mind you, the virus not just a single cell organism, they are weak, outside the human body also, just take it maximum stay for 7 days or so. But if you use good alcohol, I noticed most of the barber there for salon, they burn the clipper there with some alcohol. That's what's interesting. With flame, for sort of inactivator. So it is just they forget several clippers the way that they use, and of course they don't for exchange blade at all. Now make you way they go back. I can tell you my own point is that they can your blade go if you can, and if you able to carry your clipper go, you can able to carry and go. But not so everybody get a combat something for carry your blade go, and so you get for make sure say they open a new blade in your site. Most of the actually they do, and they show you the packets of the blade, say this is new, they open out before they begin using on you. And if you insist on that as well, if you're able to carry your blade, go make sure say wait till they use the actually sterilizer in front of you before they begin using. You have all the time in the world because you get for protect yourself.
Okay. Now, for my family, we not to avid practicing Christians like me know they practice Christianity that much, and the one that we know to religious, I would say religious people, and basically, or when they practice Islam, I would say that alcohol way we can drink, like we doctors say, for try for one. So instead of drink the alcohol, maybe for can go to the barber shop, where they go so they go dock the comb day before the barber here. Yes.
No, sorry. The alcohol way they drink also the same as the one that they use for sex life, please.
Come on.
It could, I don't know. Well, to the best of it, I different methanol or something they use for sterilizing. Dr. Command, I former surgery. So when we drink that alcohol at theater, I know some people know it, but
at least I don't make some people laugh. I come to Anne and Seku. I'll go to Dr. Rashid. Dr. Rashid, let's see. Who say don't go now? Rashid Conte. Oh, yes, sir. You say you ask question. Go ahead, sir.
Yeah, well, first of all, thank you very much, Professor Dr. Senessie, for this very important presentation. You mentioned, say, hepatitis, then we get about 5 names according to letters. And then you mentioned, say, some of the hepatitis is self-limited. That means it can go away without treatment. Some it can get symptoms way mild, while some can get more serious symptoms, even up to jaundice. So my question is, at Dena village, I feel some of the symptoms there, but now mild one, maybe nausea or just vomit, mild symptoms. How I gonna say this not the kind of hepatitis where I no need for worry about, because doctor did say it can go away without treatment. How I gonna know? Or how I gonna know say this not the serious one where I need for friend doctor? My question.
Thank you very much, Dr. Rashid. As I say, generally speaking, whether a bacteria or whether a virus or whether a parasite, now 3 factors that will determine whether they come down to the disease. The first factor is how virulent, I don't know the virulence, how dangerous is the particular pathogen. You know, if na A you get or na E you get, those are ones to them, you know. But again, you can get A, B, C, D, you know. And then secondly, waiting at the dose of the virus or the parasite you receive, then will make you come down faster with any disease. Those are the basic of infectious disease. And then, and the third one, are your immune system, how robust, how strong are your immune system. Those are 3 factors that will make that you come down with any disease at the basics of that. However, notwithstanding, according to the WHO recommendation, we are aware, say, we are aware, say, in low and middle income countries, that advanced facility will not get an eye. You know, even in Sierra Leone, maybe you go for come to the big major cities then, or so for let you go access the test. I mean, we'll go for mobile clinics then, even the surgical patient, they will could try for operate or what for do the hepatitis B at least minimum. You know, I'm Zainab can attest saying that there's a for provide the kits there because we are not here diet, it's quite expensive. So my advice to these people in the village would be, first of all, prevention is good, but then when you go for try for test yourself, which unfortunately could not be locally available, but with a little bit of push to the other countries, or to the other cities that are Bo or Kenema or Makeni or Freetown, you will be able to get yourself properly tested. You know, I can tell you a case of a Pekin who meets now on the mobile clinics in Banff. They not get all the facilities there for test time and do the profile, the hepatitis B profile. So I began for pay for that Pekin for all the way for Twitter, taking mama and people they can't free time. Get a proper profile of the liver and get a proper this hepatitis B markers them so that at least we get the best baseline for them. So that it will go back on above, but we can't do it for every Pekin. And that's what the WHO is saying, that we need more resources, human, material, and financial to be where we are. That's the fact of it in low and middle income countries. Here in the Western world, in Switzerland, we are all insured. You know, you get universal insurance coverage, and in the UK, maybe you have some part of insurance coverage or total insurance coverage, which is non-existent in the low and middle income countries, which is why the message will be on that primary prevention between the virus and the person, you know, and then of course the secondary prevention and tertiary. So we are still going to get there by 2030. That's why that document where I will share with you, it gets all the roadmaps and a way to what to try to achieve, but the resources is lacking.
Thank you very much, Doctor. Now the same thing way we can always say no more, which is the reason why I could bring this program as well, is that everybody gets a part for play in the various medical stuff the way they happen in Africa. Not to say no more, you just get for go to university and know, you know, practice, you know, medical stuff, you know, whether not financial, whether you angle volunteer no more just for help for things in career. You know, there's a lot of things in the way we need for do. We all get a part for play. I hope see them program also go try for encourage we all for low try for do we own as little as we can for make sure say we help people them. My family, I know say Sekou and Sulaiman are the wait, but Edward we don't come before. If you don't ask question before last seeing question. Whoa, boy, Edward, lie down. Let's see. He say, how can an infected person with, he said basically person with fresh, you know, with fresh like Dr. Kamasu, or with fresh, you know, if he's sick normal, you know, how you go able to know say, you know, he get him without, you know, go for test immediately, how he go, within like the thing they wait for look for.
Well, if you
get a rash.
You not get a rash, but basically, if you feel unwell and then if you get index of suspicion, say you don't engage in some risky behavior, or they don't get a blood transfusion, or you get some index of suspicion, say I don't accidentally expose myself, get yourself tested.
So in a way, you go ask, because the reason we make ask this now, these are just for the benefit of other people, not for we waiting now, because we waiting now, we get a lot of facility we available to me, but for the guys then waiting back home. I know, like me, most of the one they will know me. Wait, see them sick. You know, they don't try the normal, you know, every day 1 or 2 tablets, you know, well, the next one I can see, go for a test, go get checkup, you know. But one, not all man get that money there, and 2, not all man understand that. So, and but conversation they wouldn't do, most of the thing they would say is that for let people and go check. So, are they ask this as a general now to the whole doctors them in the panel? When I go advise, say, if somebody's sick, you know, just like how they advise the people that will know me, see if they don't try the few remedies them in no work, i.e. the normal, you know, over the counter medication in no work. When I advise them say for let then go for medical checkup, you know, for tests and stuff. Like the advice and the general advice and they go be. I see Dr. Kamal they give thumbs up.
Yeah, thank you so much, Prof. Hats off to you. Brilliant presentation, and I hope so we all go benefit from that. Now, obviously, I can always tell people and say, then can't talk how they create these questions. 1, affordability. 2, accessibility. 3, availability. And then 4thly, the sensitization and the awareness, you know, and the knowledge. The fact is, you can't tell, say, I don't get this sick. Like how they ask you, A, B, C, D, E, until you get blood test, we go confirm. It's as simple as that. But until the blood test confirm, you know nothing that this you get. However, the A, it can actually limit itself, just like our Prof they say. Because what you do, that way, by the time they get them, you know say you get them. 12 weeks after, you will begin pass urine way black, like stout. You understand? They feel unwell. So that tells you there's something not right. Because the urine will not say yellow. If it's black, then clearly you know say something not right. So therefore, you get checked out. And most of the time, if you get checked out, by the time the urine the black, you know say the person done it well already. Because what you do now, the hepatitis A, they do that. Hepatitis B, obviously, if you did your eye white, yeah, all of a sudden you see your eye the yellow, feel unwell, belly they at you, they feel sick, one for vomit and all that. Clearly, you can forget checked. Not to forget begin passing that corner to Pabu for say, la go get bang bang, go get check today. No. Go na the place usai, then go do the blood test and find out. Because you see, you not only they put yourself in danger, but to the family at large and the doctor will get for treat you. Because by telling you reach to them wait until the flower don't pass back, the water don't pass the flower, then obviously you don't reach until from the acute stage to the chronic stage. And now it becomes a bit difficult for reversal. So my advice to people is that if you begin feel unwell, you don't take paracetamol, you don't take ibuprofen, better, you still they feel that way, the joint then they are, the body they are, the temperature they go up and down, you feel like say you get malaria, go to the place where they will check you. So then 1 gram blood test will save your life and it will bring you from chronic at the acute stage, then catch them, and that will be better for you. That's not my advice. But no go begin say, because this don't happen, that's what I got. Because of the fact that you go save yourself. And secondly, if you don't get the money, it then creates the problem, say, because when you go to the place there, when they charge you, sometimes I make some people in the go. So this is nothing that we're going to think about. Now I talk about affordability. I talk about availability, because sometimes you go for go see doctor, you don't get her. You understand? Thirdly, if the doctor sometimes not get the knowledge of that, it becomes a problem. And in terms of the availability and the affordability, that's where the problem arises. So how we go for manage that? How we go for get that going? This is where, because the drugs them sometimes we get for do or we get for take, then cost money. Sometimes the medication we get for take cost money. And if you don't get the money, for afford them, what then happens to you? Suffer in silence, like the person within a village. So you don't get 2 penny for all, but you don't even get a ration of a meal a day. Therefore, it becomes a common problem for we all. How do we go forward? But if you know, say you're sick, until you get person we go for help you, then instead of you go begin fend bangba or say kuturin at the corner, feel say you don't well, when the thing just the mask. Because the liver, just like our Prof talk, 70%, 80% of them go down completely faulty, don't go sick, it really done bad, it go repair himself, they believe. But as you get to 80%, then obviously 90% will begin feel the symptoms the way by then the thing not too bad. So the liver is a unique organ. If you see, when they transplant the liver, now so it's small. When they transplant it's small like how my finger than this. By 12 weeks, it don't full up the right upper quadrant, the right upper side na ibole. So it just tells you the liver unique. It regenerates itself, it well itself, keep itself, good. But the fact is, we get forget the proper way for doing. Now I make always advise. If you don't try 1, 2 things when paracetamol, and then they don't work, try for Fen Road Hospital. Let you see how they go help you. Thank you so much.
Thank you very much, Doc. I see Dr. Toure himself give thumbs up. If you get anything for Dr. Toure, please feel free. And one part of the advice that only can give the people away know me, not just because of the show, but as something I don't advise them for a long time. They can happy for go out on the weekend, spend as much as they can, or maybe they get the baby or whatever it is. They spend money for them. But for spend money for themselves, they could show say Wεll Bɔdi Bεttεh pass Gentri. They go prefer for keep that money, say, I'm a business money this. But if you bend curve, you're not coming back. So that money then go use for do something else for you. Other people in the council don't eat them. The other question we ask is say if they fend up a newly born baby, any treatments there for her?
There are treatment options, but it depends on the country where you did.
Exactly.
So the best will be, go access your facility and let us see what are the options. I don't know the situation in Sierra Leone. I'm very happy for hearing from Dr. Lako. He handed up.
Okay.
Let's go. He's one of the top leading guys in Sierra Leone. And Hakim is also there on clinical trial, and Dr. Toure. We have really exciting guys here today.
Perfect. So Dr. Toure, then our review panel, but then here back come. We get Dr. Lako. Sorry, I will ask Dr. Lako for on mute himself. Dear, me fumble them on the professor them. Oh no, sorry. Dr. Toure, don't go off. Dear Elkwe, basically, if Pekin born with 15 back home, waiting now the option we are available to the doctors them or available to the parents for help that Pekin, waiting on my own advice. I can go for so that also I ready now.
Yeah, maybe
it's okay.
Regarding waiting to happen back home and I don't know if I will able for throw much light on that because it's been a while work day. So All I know is like how Dr. Senessie say, when I'm born picking, day 0 within 24 hours, then they get a vaccine for somebody like chronic carrier, woman we born, and they get a vaccine. And along the routine vaccinations that we're picking, they get throughout from we born till 1 year, hepatitis B included with the other one day. Right. So back home, I'm not able to tell much. And the other thing also I want to add regarding the question then be asked about somebody go expose, like again needle stick or post exposure, then go barb you and all anything in there. Then can do you test you hepatitis B if you already get immunity to run. If you not get immunity to run, then they give post exposure prophylaxis, so they can give. Immediately within 2 days and can give you that vaccine, the immunoglobulin. Then they give you a couple of months after, and then they can test. Even for the Pekin self, where in Mama Bonham, where you get chronic hepatitis, after some time, they can able to test the Pekin mark and see if it get them or not. So it's all about vaccinations really. So the availability of that back home, I not go able to tell if the vaccines then they wouldn't go give routinely. Maybe personally they down they currently go able to tell.
Okay. Dr. Lako, you go able to help with? Okay. I'm not thinking.
Okay, so yes, good afternoon, depending on side I can say good morning. I want to tell Dr. Senessie thank you and the whole of the team for this initiative, for continuing to educate the people of Sierra Leone on this hepatitis. Truly, I believe the ministry appreciate this effort, especially at this time where we need for raise awareness about hepatitis so people are aware. The ministry is trying for make hepatitis a priority. And in line with that, a lot of efforts don't already be placed on them. Dr. Senessie mentioned, say, there is a planned sero survey. We know say hepatitis is a big problem based on estimate where Dr. Senessie mentioned. Salon, they estimate say 8% of people can get hepatitis, or even more. And small study, they don't confirm this. Some they even get more people that will get hepatitis. But it will be challenging if we not get national information on this. So it will help for plan well. So in line with this, recently the ministry secured resources from China CDC for make to conduct what we call a nationwide representative study. So a study will go tell me exactly which are the burden, not the estimate of what they make. But we're not going to just stop there. With this study, we'll also assess the behavioral risk factors, the things that really make people exposed to hepatitis. Then at the same time, we assess the people that we actually need treatment exposure. So many things are going to be assessed in this study. The reason is we want to use this information because they also get money for develop a national policy on hepatitis. From that policy, they will extract what we call a strategic plan. And national with a cascade event. So working with partners there, including Dr. Senessie and his team. So this is a good thing. But they try small. Although there are challenges, we are picking up. But as I talk now, we already got a guideline, which is a draft, but in advanced stage. We don't do national reviews of the guideline. The next process now is not even sent out to WHO AFRO. They said don't do their own review, and now they don't send out WHO headquarters in Geneva. So we expect in the next 1 to 2 weeks, and we'll give you feedback. And also now we look at those feedback, we'll validate at national level. They will get what we call a national treatment guideline on hepatitis. So these are the directions they go. Government additionally gets other interventions where they will undertake. For example, the introduction of hepatitis B as part of the expanded program on immunization in 2007. And when you look at the data, based on the small studies that people don't do, you realize there is an impact on this intervention where government already introduce hepatitis as part of the EPI program, where picking the way they're born, and they get hepatitis B vaccine at 6, 10, and 14 weeks. And the impact is that a study we then conduct in the year 1997, 1998, we show say picking them when a school going children, they may get hepatitis prevalence of 16.7%. And the recent study we US CDC do in Barcelona among them picking them, they realize that the prevalence don't come to 1.6%. Another colleague even do a study among people who get HIV, picking who get HIV, the prevalence even among those one way, now a group where they at risk, it don't come to 2.0%. Now this implies that the intervention we government introduce don't make an impact in reducing the burden of hepatitis from that high level of 16.7%, even though now it's
it's like we don't lose Dr. Lako. All right. He will join me back as
okay.
Yeah. Dr. Kama?
No, it's good. Let's continue.
There is a global hepatitis. We should get hepatitis to.
All right. We go join them back in a bit. Basically, some of the questions that we don't come through is that how we be able to reach the local people back home. Because at the moment, this only restricts people to one day we get access to the internet, Facebook, YouTube, and Zoom. This is something we only appeal for the past 2 years from where we start, is that we want to reach people. We're not charge people for this program. We're not for charge anybody. We're happy for GAM for free. All we to look for is if any news outlet or media outlet they back away willing for take on the show and can go to people and we willing for getting the material. We normally come up every fortnightly and all the program they wouldn't do, they recorded. If they want we pre-record them for them again, we will happily do that. If they want them in a specific way, and just make we know, we will give them. But if anybody there in the audience or anybody will get influence with them media outlet and they back home, please reach out. I will share with number at the end. Please reach out. We're happy for engage anybody for we get this message to the people, and we really need them compared to waiting so we get facilities then we will keep rely on. Okay. Dr. Laka, I'll come back to you in a bit. Mr. Sekudi.
Hello. Hi.
Hello, sir. How are you?
You hear me? Yeah, I'm good. Thank you. Thank you for giving me the chance to talk. I would like to thank Professor Senessie for the time and also the coordination to put it together and share what they been doing for a long time now. It's a very good initiative. We need that in particularly in West Africa. So I just want to come back just a little bit to about when the question was asked about how long the virus can stay out of the body. Just want as Professor Senessie explained it. I think that's point I would like to just emphasize it. I think with my small knowledge in Creole, I might not understand what Dr. Senessie explained it properly. I just want to emphasize one thing there. Because back home, when someone gets injured, most of the time people rush to put their hand to help, which is a good thing. I think with organizations like Give All, they doing a good job to educate people. What is, I think, is very important, and this is where my question will come later on. But first thing I would like to emphasize this point: how long the virus can stay away out of the body. Myself, I work with CV, with the hepatitis V virus for many years in the lab, where we have to receive sample and also using the copy of it where we made it less virulent and to work in the project. And we have these two kind of viruses where we have one copy which is used in the lab, not very well, and the wild type from sample to use. But what is advised, as you people ask about using alcohol can stop the virus. The alcohol is only to fix the virus. And also you can see when people be using, they ask people to use the hand wash spray. Those are formulation of alcohol 70%. Why 70%? Because if you use alcohol 100%, the alcohol is volatile and will not, the time to fix it, all the alcohol is volatile and then the virus will not fix it. But when you do to 70%, the same time you have the aqueous retention and the property of alcohol to fix the virus. That is the main purpose of the 70% alcohol to fix the virus. Now, this is not immediately effective. In the lab, what we use for proper to deal with the virus is the bleach and another strong version of bleach is called Varcon. And all of those, all human samples are classified like highly infectious. People working with it must be in the category 3 lab. So as I said, the education with our people, and we have to be careful. When someone is injured, we have to pay attention, educate them, not to rush. It's good to help, but try to have some precaution there to how to handle any blood. Any potential blood is potentially infectious. So this is what I wanted to emphasize. And this virus, as Professor Senessie said, can stay over maybe seven days alive without being in any host. So we have to be careful with that. Now, here we come my question to Professor Senessie. As I said, I had a chance to participate to the seminar by Give All. I think that they're doing a good job. So my question to Professor Senessie is, as WHO, which is actually the big organization, and most of African countries rely to in terms of their health. I know countries like UK and others, they can manage their own facility in treatment. But most of countries in Africa rely on whatever WHO be saying. My question is, in this kind of bringing campaign to people for awareness about this virus, is that all hepatitis, how does WHO support organizations like Give All to bring this message to people, ordinary people around, for them to hear and also to be aware of the danger, and also be aware of liver disease like Dr. Toure explained earlier. Thank you.
Thank you very much. So the question, Dr. Senessie, it gets two sides. Basically, it's about how long the virus, they stay outside the body. It's like explaining it in English for them, understand better. And two is how big organizations like WHO, they able to support small organizations, then where they, in them local African continent, they follow they're able raise awareness on the NTR and how they able to get, small facilities and for prevent the NTR. So for example, like say somebody play with blood, teen for them able to wash their hand, but also the sensitization as to when people for do certain things, how they for do and for them make sure they stay safe. I hope that makes sense.
Yeah. Thank you very much. Regarding the virus staying outside the body, it's temperature dependent. According to research, it stays for 7 days at 25 degrees centigrade. So if you pull the virus, put it outside the body at higher temperature, they die faster. So that's it. That's what the research says. Now, going back to the issue of the WHO, I can only say this at country level that the WHO work. Before I come to the civil society, that the NGO, the WHO get a platform for them. And the WHO work best with countries, with national health authorities. That's that dynamic, I can always say. And the fact is that with national health authorities, now we are the custodian of the health of the people, just like the WHO is the custodian of the health of the world. But we are free to develop our own guidelines in line, not 100% of the WHO because of the population dynamics of every country. So like what Dr. Lacord is saying, WHO then get a standardized guideline. They can use the survey and the methodology, or we can use something Of course, you external validity get for be guaranteed, etc. But we therefore make sure say we develop some specific our country specific interventions, and that's very crucial. So the WHO will provide a platform. They will afford with resources, human material and financial. We work with other partners there. We'll get unique identity and data for we country Sierra Leone. We go fit into on the international scene. And yeah, in terms of
so waiting, Mr. Secretary asked as well is how they go able access their support there.
Exactly, that's where I'm coming from now.
Okay,
it means now the underlying thing is that whatever the NGOs or the civil society are doing, it should be to complement the effort of first of all the country, the Minister of Health, and then the WHO. So the WHO will refer you back to the country level to say, go and work with the country level, support what they are doing, and then come back to us and feed it into our system. Because I get an NGO, the Medical and Research Network, I'm United Nations accredited, I work with the WHO and how that does work. They'll provide you a platform, but you have to align your effort to the specific countries or continents of origin. And that's very important that, i.e., no organization should bypass the Ministry of Health of Sierra Leone and come directly to the WHO. They should walk through the Ministry of Health to come to the WHO because you are there to complement the effort of the Ministry of Health. I'm very, very, very passionate about that, not only for Sierra Leone, for all the countries in Africa I work with. We are there to complement their effort. We are not there to bring a white elephant. So when it comes to hepatitis awareness, nobody does it alone. You work with the country, you work with Dr. Lako and team and Minister of Health so that your effort fits into the overall national agenda. And then it becomes accepted to WHO. They will not give you a single platform as an AMREN to go down to Sierra Leone and go and work independently. No, you have to work with the Minister of Health. They are the custodian of the health of that country. And that is a message I very much like to resound, for you to resonate with all the NGOs coming, because I've been in the NGO sector for 29 years, up to the UN and WHO level. Okay.
I hope that makes sense. Basically,
thank you.
If anybody gets any way you want to go help and stuff, make sure say you go through your national health service, speak to them first, make sure say you get them buying, then go able to channel you now outward. Okay. I know say some people will say their challenges, but we will left that discussion there for another day.
No, it's good. It's good. That normally, no matter your opinion about the WHO, no matter about the opinion about our Ministry of Health, they are the custodian of the health of that country. They know the system better. They know the road better. So keep your opinion, go and align yourself with Dr. Lako so you have a national agenda. It augurs for sustainability, it augurs for that sense of ownership of projects. That is very, very crucial. Even with the WHO, I tell them, you don't use me to go to Africa, go to my Minister of Health, work on the bottom-up approach, not the top-down.
Perfect. So I hope, Mr. Sekou, I hope Dr. Senessie has answered your question.
Yeah, it does make sense, yes.
Thank you very much. Dr. Lako? Yeah, you're not finished. Yes. I'll come to you, please. Let Dr. Lako finish with CBDC, please. Yeah,
okay,
go ahead.
Okay, so let me just summarize. So yes, on the issue of prevention of maternal infections, that Pekin for prevent the passing of the hepatitis B to Pekin, where mama get the hepatitis, we get belly. Apparently, for now in the government sector, we'll not say we get everything, but there are private pharmacies, we get drugs, everything. And for the government sector, for the hepatitis B test, based on what the guideline recommend, those services are available. And with the access, anybody who pass on information about hepatitis, make it tell people and say, Bele woman, for test for hepatitis. If you get hepatitis, then how they go assess and for know if you need treatment for further prevent the Pekin, make you not get hepatitis, but at the same time for you well body business. But if you not get, we also will say more than get athlete, so it will be prevented. The other facilities were available, we government not implement it, but some private people and get them, what they call the back dose. So for the woman, we get hepatitis. If you born Pekin, within 24 hours, side away, then they will get the maclate. And then they give other things they would then call immunoglobulin. Then facility, and yes, government will bring the aid, but in some pharmacies and some places, people and they provide them services there, and some people they utilize them because it's necessary for making protective Pekin may not acquire hepatitis at that particular young age. And even speaking that we happen for end up forget hepatitis, for which the mama had not been take preventive measures. Some people and they will get certain drugs that we suitable for them picking there within the country. We agree say and costly, and now there is no system for subsidize that cost there within the government system. But however, if you get the resources, you will be able to get access to their services there. And services also there for adult population. That even within the government sector, people are able to get their services there. We they say in an endemic area like this, we they say saloon, it's good for all man know his status. If they say nearly 1 in every 10 person get hepatitis, and tendency they for like live in a neighborhood with person, now they share their FF sharp then, so then you cut there. Inadvertently, you might get exposed, you know, aware. So it's necessary for a lot of people and not even wait till they're sick. Because what we don't see in one study they will do, we realize that 92% of people where they come to me. They not even get 92 out of 100 people. They get the virus, but then they feel nothing. However, the few one day where they feel something, where they feel, say they feel sick, where they encounter, they get liver cancer, which is difficult to handle. Then get already, where they say the liver don't harden, you don't get boku scar as all Dr. Senessie been they talk. Those are things that were difficult for handle. So now a lot of people wait, they reach to that level. Come early, regardless of the symptoms where they get, make sure you can at hospital. Any government hospital, they're able for testing for hepatitis. And then we're able to provide the necessary advice where you need. You know, say hepatitis management is complex, unlike maybe HIV and other sicknesses. But now take to the advice with them when body people I don't tell everybody.
Okay.
Thank you. And over.
Thank you very much, Dr. Lako. Let's see if he's still there around. Because few questions in the way somebody will ask as well, see, you know, if they want to try for help, how they will go about for help if there's any organization in the way, and that's a long way they help with NTR. I don't know if Dr. Lako will be able signpost, give you some signpost. I will share with number at the end. Please do. And the post where they ask, I will ask the numbers or what they share at the end. Please reach out. Any recommendation we will get, we will pass them on. I don't know if Dr. Senessie himself, if Prof. Senessie himself get any organization at one way, you know, it go like for people and we generous enough, we want, you know, help. If you get any way you want to recommend, please do. Share them at the chat, but also share them with we. So anybody will get in touch, I will pass the information to them. Okay. I go to Abubakar Ba. Sorry, I don't keep you for wait so long. Abubakar.
Yes. Good evening, everybody.
Hello,
sir.
Dr.
Ba, specialist pediatrician. Yes, I don't know if they get me.
I hear you. Yeah, I hear you.
Yeah. So I want to thank the panel and the organizer them for this presentation. At least it's good for me to increase the awareness of hepatitis B in the country. And maybe work at the pediatric wing. And I just want to light on what Dr. Lako say concerning a pregnant woman who gets hepatitis, where infectious don't deliver a baby. So for me, we will prevent the beginning from not getting infection. Now, if we confirm say the woman infectious during that time we deliver the beginning, we can do some things then. Immediately within 12 hours, if I get the hepatitis B immunoglobulin, yes, Dr. Lako, that's true. We not get them under the government national policy, but private facilities and we get them. That one in a one. Then we all know say we own immunization schedule. The pentavalent vaccine, they start at 6 weeks, where the hepatitis B vaccine included. But in this scenario now, we not wait say the begin 6 weeks. We dey start for GAM in your vaccine one term. But the good thing where we for know for the people where they administer the vaccine, if for be the contralateral arm, if you don't get the immunoglobulin, hepatitis B immunoglobulin at the left hand, when they get the vaccine, if for be the other hand for make at least we not introduce counter for me the vaccine will be counterproductive. That and the other thing. Then 6 weeks we will test the begin, see if you actually infectious based on for doing hepatitis B and panel. So we know whether at least it's still exposed or you not get the infection. Then the other thing now, because we all know say hepatitis B not to be transmitted by breast milk, but it will teach the comrade
Okay.
Attachment and breastfeeding, because through that process they can get infection, not necessarily through the breast milk, but if you get they attach well on the breast, mama get any crack nipple. Yeah.
Dr. Abubakar, I'll go come back to you. Your network don't go funny.
You get when I get me?
Yeah.
Yeah.
Hello?
We hear you, but I think you break up a little bit.
Yeah.
So, but you can still come over again.
Yeah, I will come back to you.
Vaguely.
Dr. Ba, I will come back to you. Bernadette Kamara, I think it is. Bernadette?
Yes. Can you hear me?
Yes.
All right. I want, first of all, to thank you guys very much for what you're doing.
Thank you.
Because it saves lives. And I want for Leonano, Mr. Dr. Kamara, Dr. Mohammed Kamara. It didn't at the line.
Yes.
I want to tell you that he is so proud of you guys. So proud of you that when he came at the US, we were talking. I get a foundation as alone where they call the Baniso Foundation, where they go now the provinces them, some places are the bill, depending on the need, whether now at our wells them, at the bill school, at the bill mosques, at they do mortuaries, anything no more where they need, now the different area, and it's all around the country. And so because of it, I work the government, the embassy here, I work with them very closely. Where Dr. Kamara came the last time in America, he tell me about Una and just the brilliant work Una they do. And he tell me how we should get it to the next level. And I told him that I am going to help. This is how I'm going to do it. All of the things that Una they talk is so important, so necessary, but it's not gonna do what you guys want it to do until you become a nonprofit organization. This is why. If you have a nonprofit organization and to the caliber and the expertise we will already get in this group, if I will say, would they do request here from manufacturers and doctors and hospitals to give you guys equipment that you're going to need, because first and foremost, you need to be able to have diagnostic centers. If you not get diagnosis center, salon any sick, na malaria or typhoid. So you will not get the right diagnosis. And for you to do that, you need these machines. Now, they are extremely expensive, but there are companies that are willing to donate that to the likes of you because of the work you guys are doing already. The government, one of the things I listen to the thing, everybody where they contribute, the government, the reason why sometimes they're restricted is this. I do farming also, they help people there with farming. I do it for free. But if the government, then tell me, the Minister of Agriculture tell me, say, once and we tell them, say, we're able for lend them tractor them, for let them go farm. But because it's the government that said it, and based on the history, the governments normally don't go down to the provinces to try to help people do something specific like that. They have very little result to get to the people to actually do it. The private sector, on the other hand, the way we say you get organizations and where they reach to the people, then whether not the provinces or not the villages, them they for reach they already know them. What we need to do, what I'm hoping you guys do, is to educate the people via radio, via television, via everything. And not only that, have people like materials, marketing materials. I'm a business person, so marketing materials, but information that is going to be given to these people, maybe meet the headman or the whatever name they call themselves, teach those people, talk to them about the importance of what you guys are doing, because I know you're doing this with various diseases. And I admire you guys so much, and I thank you guys. So Dr. Kamara, I tell him for say, I talked to the ambassador here, and me, normally when they get something at the UN, they invite me, because I've been doing a lot of stuff in the community. So I told the ambassador for say, there is this group of doctors who have made the sacrifice to work together to educate the public about different diseases, how to prevent it, how to get cure, how to pay attention to your symptoms and all those things. So you don't assure me, say, give me people them way with the align with Dr. Kamara, so that we will talk about it. And then the goal is for this group to have a stage at the UN. Because if you have an event at the UN, well, it has become global. So to have an event where maybe a few of you guys will show up here and then talk about this and see how well you can reach people. Now, the good thing about that is this: because you have done that, and now more people will know about you, you will get donations. So maybe the only expense you will have is maybe to ship the equipment to the country. But in terms of the equipment, you can get donors that will give you that. But especially in this country, if you don't have tax exempt status, to get a donation is almost slim to none, because people want to get the tax benefits. So I gave my word to Dr. Kamara that I'm gonna do what I can to help you guys get registration here and get the 501(c)(3) here, and that way, and also send to, I have a lot of group of people in Sierra Leone, get it also registered there. And then when you guys now say, okay, you want to ask for donations, the first thing normally people do is go online and check you out and see if you're legit, if you're registered and you're in good standing. And then they will be able to donate these things. Because as good as your intentions are, if they're not you're reaching people in Freetown, that's good. But the people that actually have the need, they're not in Freetown. The people we need to educate the most, they're not in Freetown. They are in the provinces. And I tell you this, I am building a hospital at Njala Komboya as I speak. We are now at the roof level. And the reason why I started building the hospital is because first I built a water well for them. But when I went there and I saw what was happening, they have these clinics that has nothing.
Auntie Bernadette, I know I caught you there, but the problem is we don't run way over time.
Okay.
What we the group will get in touch with you for let we work together and work and for let you give you advice and stuff. But the problem is the show we can normally stick to time, and right now we don't go well over time. So I'm really sorry for cut and short there. The last two I go take now, Mariam and Dr. Ba will go accelerate, but they are go accelerate and make them very short because we really don't go way over time. We can try for keep to that time because people then their time very important to them. But Auntie Bernadette, until Dr. Kamara will make sure as a group we get in touch with you, please. Okay.
Sounds good, no problem.
Dr. Ba, you still there on? Please try to make them as brief as possible, please. We really don't go way over time.
Yes. Hello.
Yeah.
Hello.
Yes, sir.
Yeah, we get you.
Your line still bad. I will go to Mariam Aso.
Yes, if I can. Hello.
Mariam Aso?
Yes, Oda, do you hear me?
Yes, please.
Afternoon from the US. And Dr. Senessie, thank you for that amazing presentation. As always, you make us proud all the time. Me name na Mariam So, me na the newly appointed advisor to the Ministry of Health on gender mainstreaming and diaspora engagements. So I'm really happy for Yariuna all na this forum, and for Mekuna no say this office is created for work with the likes of the Sister Bernadette Camara. Of course, they do some amazing work with Dr. Senessie and in group and Zainab and others. All I want for Mekuna, all na this group know now that the whole idea of that office now for help realize all the things that what we all want to do for we country, make work with the ministry and see how we go make a difference in the lives of we most vulnerable Sierra Leoneans. So get me information through Dr. Senessie. I want Mekuna all please reach out, make we see how we go work together. Over.
Thank you very much. We will make sure say we get in touch. We will take you up on that offer. Dr. Senessie will be in touch. If I'm thank you very much. I'm really sorry, say we don't go over time, but I'm sure we don't stay on all the way to the end. I'm sure say we don't regret them, so we stay to the end. I know I don't learn boku thing. Yes, I didn't also when I say yes, I do buy I get access to a lot of benefits we not in us alone, but I get few bad habits we I don't learn incidentally and they will cause medical issues in the end. Because for example, me kind job I do most of the time I didn't host. We require, and because of that, I didn't eat well, to be honest. I get bad habits. Something I can go for hours and not eat. And I like me coffee. So there's certain things that they will miss again for change as a lifestyle change, lifestyle changes and we miss again for make. But as until we I believe say boku of we na go don't learn from so I go ask say do you for we own health where we go back. Lord will try for make small changes and they say make them all of a sudden born and make them small. I'm sure the doctors in there. So what they can do now, they can go around the panel and ask, let them give our last word and we will finish for today. So I'll start with Dr. Senessie, please. What's your last word? When a final advice or word where you want to family, then make a short, please.
Yeah, well, the last word is that if you get anything, we know the unbug you to have to see your doctor as fast as possible. And then secondly, also we get a lot of organizations then where the question you be asked, like the Zainab in group, we give all. They are registered in Sierra Leone. They work with the Ministry of Health to complement their effort because Dr. Lako was part of their speakers during the last World Hepatitis Day. So, and there are a host of others. Mio Network is more broad-based, overarching in lots of areas of anything that affect low and middle income countries. We are always there, So I would advise you to work together as a team, complement the effort of the Ministry of Health, and also reach out to the low people that are the villages. We need able access here. Now we'll go mobile clinics, health outreach posts, empower them so they contact universal health coverage. Let them be left behind. We leave no one behind. So that's my last word. Thank you.
Thank you very much, sir. And thank you very much for your presentation today. Dr. Kamar?
Well, as I say, I don't know what to say. I just say immense thanks and kudos to Prof. Senessie and all the team members, Doctors Lako, Sekou, Diallo, Abubakar Ba. I think I even see Dr. Russell, James Russell.
Yeah.
I think. Yeah. And sadly, we never forget for hearing from him. But it's so important that a galaxy of brains. Now, somebody mentioned the fact, say, how we could get this thing for actually disseminate, get them right there to the people that we really need them. That is the question. At this now, we grapple with all this time. And I'm glad you say people in the sea. And I'm so happy that newly appointed lady, Ms. Mariam So, don't see what you will go for do with the resources where we get. So with the appeal to people and for say this now for una, not for we. Now make we think about now and talk in KRIO. If now other people they think about now English they talk, but we talk in KRIO. And remember, we not for suffer in silence on we own. We need for understand say price no dip and we Wẹll Bɔdi. So therefore, Wẹll Bɔdi it better pass Gentri. No matter how much Gentri you get, if you sick, that money they go down and the sick will take you go. So remember, Wẹll Bɔdi Bẹttẹh pass Gentri. So help we, for let we help you, and thank you very much to everybody.
Thank you very much, Dr. Kamara. Dr. Bell?
Yes, Prof. Thank you very much for that wonderful presentation. I mean, it really informed we and informed a lot of people about hepatitis. I want to give us out also a shout out to the awareness group. Awareness group, very important. I mean, because you actually find out say the awareness group and they help for inform people locally as well. And if we for develop that awareness group there for be larger and for be also get chapters in different parts of the provinces, that's going to also be great. So awareness group is very, very important for hepatitis. This awareness group in hepatitis is one of the big things we will happen as well. We were able to liaise with the ministry as well, liaise with also parliament as well, for also bring out laws and bring out also informative materials them as well for inform people, especially in the villages them. So big shout out to the awareness group. And waiting for Professor Senessie don't talk back hepatitis A. The one thing we get for do for prevent them, definitely hygiene. So please now wash your hands, now disinfect your hands, especially the one that we sell cookery, for instance. If you go to the toilet, wash your hand. And also, if you get disinfectant. Now we COVID don't come, so all man get disinfectant. Yeah, and if you look the one more you get, make sure say na good one. Also, water then put inside it. But it's very, very important. Hygiene is very important, and water. Now one of the one major thing we need for improving hygiene as salon. So make sure say we able for develop a sanitation system as salon, and please, very important, wash your hands. Concerning hepatitis B and hepatitis C, definitely infected needles. Then baba them will, then we go to dentist to all in place, then they don't want to take drugs. So therefore watch out. It's very important. Prevention is better than cure. We always talk about the medicine way for take, where you get this disease or that disease day. But you got to prevent yourself from getting this disease. And you will get your body. Now you first will do that. Now you first will make sure say you're able to prevent yourself from getting this disease. Yeah, and also the one main thing about your about salon is that when they keep picking the medicine, that's where they go picking the Panadol or paracetamol. Not going picking adult dose of picking medicine. Yeah, for picking a body pain, you go give Panadol. It pull up picking a liver, and that liver is an essential organ for live. So a big deal. That one day we can go begin picking. We can say over the counter, and we can say, okay, low men and for small people can go hospital. No, we can't picking. And no mix panandi. No go give picking adult medicine. That's very, very important. And then I want the way for with the bend and shoulder. Man, you find for bend and shoulder, and they can also good for the health one, but not bend and too much. They bend and too much, that liver self, it can bog, not go able. You understand? So with Professor Senessie don't talk, a big deal on a take on to heart. It's very, very important. On the virus side, very important, but also on the other areas them concerning destroying your liver. As I say, the medicine we need to take, and also alcohol, cigarettes, and everything. It's very important for me to take care of your body, because Wẹll Bɔdi Bẹttẹh pass Gentri. Over to you.
Thank you very much, Dr. Bell. Dr. Toure?
Yes, thank you so much, Professor Senessie, for this presentation. At least the length of this session don't tell everybody how complex and how important hepatitis be, or hepatitis as a whole be, how the liver very important, you know. So we can do this show here every 2 weeks. So we hope, say, all the people who we present today, present in 2 weeks back, we get a different presentation or they give will be useful to everybody, you know. And for we people and back home, to guys say, Wẹll Bɔdi Bẹttẹh pass Gentri, prevention is better than cure. You know, when you sick, see the expert. Instead of you go on a different side, then people they go meet, they go spend money there, where it will end up will even damage you more. Then medicine they take, native medicine, then we know go cry and down, but we don't know the dose and concentration and all anything that they affect the liver as well. I mean, Dr. Bell don't talk about the other thing I want to go repeat as well. But law we just aware say, you know, law we meet the people that we know say yes, health is expensive anywhere in the world, even in the advanced world. If you want to go private, it's very expensive. But your body, if you really take care of your body, it better pass the dollar, pounds, and leons way you get. So in 2 weeks' time again, we get this presentation. We hope so all will come and I will join we, and where you know well, you go let them go test you. It's all about testing, and the way you know your status, you be honest to the other people so that we not and spread this thing around. So we tell you all thank you for una come, and thank you so much, Professor Senessie, for this session. We hope so una will join me in 2 weeks back. So Wεll Bɔdi Bεttεh pass Gentri. Thank you.
Thank you very much, Dr. Tui. And the last one on the list, Dr. Rashid. Dr. Rashid?
Fambuda, I thank you for coming this presentation today. And I want to thank Dr. Senessie for this important talk where we don't can talk to we. If we've been listening carefully, Dr. Senessie talk about the functions or the work where the liver they do. Obviously, you know, we'll talk about something in sick one where you know begin by what they do. If we not been listening well, if we don't know say the liver in work very, very important for the body. And so like any other organ in the body, we get for take care of the liver. We found the way like native medicine. I know they condemn that here, but we for no say any native medicine where we they take, it gets a toxic effect in the body. And at the liver, now you get that work there for remove toxic chemicals from that medicine where you don't go take. Even the conventional medicine, all medicine gets the bad thing where they do in the body. The only good side is in very much measurable, calibrated. Now you make doctor they give you dose. So that way they then will control or monitor the side effects. But native medicine is not calibrated. So if you take too much of that, the problem where you want for solve, it will just end up for create the very same problem. So fumble them. Una thank you for listening. Make we help the people that especially are so passionate about the people that way they in the remote villages. Because I've been there in a salon during the war. And what I experienced, we've been to do some little mobile clinics. Now that this idea born and mind say there's a lot of work for doing a salon. So una help we for scatter the message, and we don't expose more. Let we join together for help the family. Una thank you.
Thank you very much, sir. The family, una thank you very much. Una thank you for our patient. One word they like you say that salon or we but people like you say Kungusa no fine. But me I tell you I say Kungusa fine. Una pass the word about Wεll Bɔdi Bεttεh pass Gentri. So we see again in a fortnight on a good night.
That's good. Okay. Thank you so much.